assalamu alaikum, good morning, khushamdi, ji ayanu, goeiemorgen, washmale. Ladies and gentlemen, welcome to Well This Morning on a beautiful, beautiful morning. Well, of course, as I always say, but it had been raining in Islamabad and Rawalpindi and other isolated places in Pakistan as well since last night. But as beautiful, as enjoyable as it was also sort of scary in some places. I mean, it was stormy, yes, the thunderstorm, it was pretty to look at, of course, but again, scary. And in some places, again, the reason why Shahzad is not here today, in some places, it was such a chaos, man. I mean, the roads were flooded to an extent, and even water was penetrating into the houses, which is why a lot of people had to face a lot of problems yesterday. But I really hope all of you are fine out there, and all of you are safe out there as well. Please enjoy this weather, because, of course, we are entering into winter, but also be safe for two reasons. One, in several areas, there have been flood warnings because of course, unexpected rains and whatnot. Number two, dengue is everywhere, ladies and gentlemen. Please avoid stagnant or standing water. Please avoid any, dirty areas to go to, because it really bothers me. A lot of people that I know, even from Rawalpindi, have unfortunately developed this disease or a condition. And for now, we don't have vaccination for dengue available in Pakistan, right? So might as well avoid going to such places where you can develop or be in contact with the mosquito. But ladies and gentlemen, other than that, I really hope your day goes amazing, because today we are talking about two very important things that all of us need to learn about. Second thing we will, of course, discuss in the second segment. We happen to be celebrating or observing an International Day, which is absolutely important and integral to our society, because we happen to be a, combined family system, joint family system, and we really enjoy that as well. But before that, let's talk about something which is available in Pakistan, first of all, of a very good quality, but a lot of people who need it choose to go abroad for it because, of course, maybe they're not very aware of the availabilities of facilities in Pakistan. But that is why we are here to inform you and educate you, ladies and gentlemen. We will be talking about neurosurgery, minimal invasive neurosurgery, if I'm not saying it wrong. And also, there are surgeries, especially of brain and others as well, where the patient stays awake, and that always intrigues me. How does that happen? I mean, is that even safe or not? I have some very basic questions, I know, for the people who belong to the medical field out there. They'll be like, oh my God, how come you don't know this? But I'm a layman. Hey, I'm asking these questions on behalf of all the audiences out there. And to answer my questions, I have with me Dr. Akbar over here. Hello, assalamu alaikum. Welcome back to my show.
Wa alaikum assalam. Many thanks for inviting me.
My pleasure. But this is the first time we are doing the show alone, right? Last time you had it with Shahzad.
Yeah.
All right. So happy to have you over here. And you being a neurosurgeon, how long have you been in the field for all the people out there?
Well, I've been doing neurosurgery for good about like 15 plus years now.
Nice, mashallah.
Yeah, and when last time I met Shahzad, I had just come to Pakistan.
All right.
And he had quite a few questions. I mean, and obviously when he invited me, the reason was that what have I brought to Pakistan? And we were just talking theoretically about what have I brought to Pakistan. So I think it's been over the last year, I've been working very hard. And in the development of neurosurgery.
Right.
And I think the targets that I had set for the first year,
You've achieved them?
I've achieved most of my targets.
That's nice, mashallah.
In this region. And that's for the people of Pakistan to know that it's not that we are doing what we were doing in 1980s. Neurosurgery has progressed quite a bit. So
absolutely.
the services that I provide here are probably only available in England or somewhere in the US.
Right. So let's talk about it, because, of course, I happen to know some people as well. Even Shahzad, he's talked to you about it, right?
Yeah.
He had to. Of course, there are, unfortunately, people develop some type of conditions that need special treatment, which on a larger scale, generally speaking, are not available in Pakistan. So that is why people resort to go abroad to have, let's say, quality medication. But you are saying you are offering even better services over here. We agree with that, yes. So let's talk about them. Tell me about, first of all, minimal invasive surgery. What does that mean? What does that entail?
So, minimally invasive surgery is a term coined by general surgeons, essentially, to begin
right.
with. Then gradually it trickled into neurosurgery. And the idea is to do any surgery, but with a very small cut. So that there
without
is less
maximum penetration.
Yeah, without maximum penetration, but with the same or more benefit.
Okay.
Of like, if I'm taking a brain tumor out or something, I mean, the video that's playing currently is actually of awake brain tumor surgery. That's a completely separate thing.
Oh, all right. This is one of your videos that you shared with us, right?
And actually, this is a patient who is. I work at Shifa International. He's the father of one of the staff at Shifa International. He had presented with a brain tumor.
Okay.
And I took that out while he was awake. I mean, there's a lot of stigma around general what neurosurgery is, but not to mention awake brain surgery. People can get scared.
Of
But what I'm
course.
trying to say is that the awake brain surgery is not just to keep you awake and have a chat with you. There are reasons behind it. So I introduced this awake brain tumor surgery.
I actually do have some questions about the awake brain tumor
Yeah.
surgery, but we will get to that. Let's talk about minimal invasive. So this was this one time, of course, I had to be operated for my appendicitis, and that was, I don't know, they had to insert this camera. This was a keyhole surgery,
It's a
basically.
keyhole
And that was the
surgery, yeah.
first time I came across the concept. I was really happy with it because I was not having scars or anything. So is it the same with the brain surgery as well?
It's the same, but there are various other things as well. Actually,
Yeah.
if you with brain is slightly different. So if you make a very large cut on the brain and you take a brain tumor out,
Right.
patients tend to linger on for long morbidity, what we call as in hospital stay, long inpatient course.
Okay.
That's slightly higher.
It is.
So what I do is that I stick a camera through the nose and take everything out, and there is no cut.
Oh, wow.
So patients tend to do well. So I've done like so many operations. Like almost 25% of my practice here at present is because I work at Shifa International. Patients that come to me have been around the block actually.
Right.
And they've had surgeries of various types, and then they come to me, and then I have to do redo surgeries on them.
Okay.
And I do them through the nose. The other day I did it on a 13-year-old kid, for example.
Wow.
And they just are okay. I mean, you can chat with them the same day almost, and you can send them home the next day.
Well, that is
And this is
absolutely
major brain
amazing.
surgery I'm talking about.
Oh, wow. So, all right. So, let me get this straight. So, you are accessing, let's say, their brain image through their nose with a camera, and then you're removing the tumor / hemorrhage or whatever's wrong with them through their nose as well,
But
without
not
any.
everything, yeah.
No,
There
of
are
course.
certain surgeries that you can do through the nose, which people make cuts on. And then there are other surgeries that you can do through the head even, but instead of making like
A big cut or-
huge
right.
stain, which is a standard practice I see, which is also traditional neurosurgery. Sometimes I have to do that as well, but to do a small cut and take it out through there.
All right, perfect. And now let's get to what we were talking about, So from what I understand, there are some videos, of course, I have seen on internet as well, not only for brain surgery, but for, mothers giving birth as well, when they are awake. What I fear is, I mean, the blood pressure, doesn't it get high just imagining that you are being operated somewhere in your body, but you're awake? How do you control that?
So the reality is there are two steps to awake brain surgery, and I think one of them is anesthetic part. Okay, so I was like, I've done, I don't know, I mean, 150 to plus. Okay, probably more than anyone in Pakistan at present, I guess. There are a few other people who've done similar or more amounts. I think one is in Karachi and maybe one in Lahore.
Okay.
And initially I started doing them like when I was getting trained in London, was like asleep, awake, asleep, to control so that their patient is okay. So they're asleep initially, and then they're awake during the surgical process, in which I have to mark certain areas, and then they are asleep again.
Okay.
But then you evolve. I mean, I've been doing it for a certain number of years. And then when I was introducing it in Pakistan, the first one when I did, obviously that was a breaking news all across Pakistan.
Yeah.
That was back in May or somewhere. And the idea was to do it awake through, all the way through.
Right.
And obviously you need good anesthetic support during that time. And it's not just anesthetic support. You need to be very well trained as a neurosurgeon to do that as well.
Right.
It's not something you just pick up and say, oh, I've done awake brain surgery.
Just plan in the morning. You know what? This is what I'm going to do.
So you need to be trained in it. And the idea was to do it like, I did awake, all the way awake. And as I said, it was the father of a Shifa International staff that I operated the first one on. And I kept him awake all the way through. I had a very good anesthetist. The anesthetic staff is amazing at Shifa.
Okay.
But then you have to plan it. There are a lot of surgical steps that you have to do during that surgery as well.
Okay.
Now, why am I keeping this patient awake? So there's a reason, I mean. There's a reason is that because the tumor is close to a part of the brain that you don't want to damage. If the patient is asleep, you'll never know.
Oh, all
Yeah,
right.
so I do extra stuff. I use neuronavigation, which is like a brain GPS at the same time, and also then awake, and that is you stimulate part of a brain, okay, which is I'm gradually introducing all this stuff. So I will the brain stimulation during the time of surgery. That's also getting introduced, everything. So this is a
And yeah,
whole
let
year
me
thing.
please mention this for everyone out there. This is, I mean, a first for Pakistan. Even the,
It's not first for Pakistan, though.
for a very long time, though, and for a lot of people, like we've been mentioning in the beginning, how for every such thing, people have to go abroad. But for Pakistan, doing it generally available for every patient out there who can opt to get it done. I mean, it's amazing to see that, right?
Yeah, but there's something else happened. Actually, I'll tell you. It's like it's
Yes,
very
please.
bizarre. Actually, when the news broke, I think I don't know, maybe 5-6 months ago, that I had done
Right.
awake brain surgery. Patients were coming to me with brain tumor and saying, "Can you do it awake for me?" You don't need awake brain surgery. No, but can you do it awake for me?
All right. Okay, so can we choose though? Can we choose? Is it an option? Can the
It's
patient
not
tell you?
it's not an option as such. It's like not every surgery needs to be done awake.
All
I mean,
right.
and some surgeries do need to be done awake. So there are various things that we do in a way. This is another tumor I was doing. That was asleep, and that's a brain tumor I did.
Oh.
This is a tumor that I'm doing like through the nose with all the neuronavigation and everything. This is a I mean, I do different things. This is a flexible endoscope I was doing spinal surgery on.
All right.
So, I mean, there is nothing much. This is awake brain tumor surgery. So, there are various things that I do, for example, which are neurosurgery is a very different specialty.
Of
I'll tell
course.
you.
All right. So I'll ask you, and then maybe you can
Yeah,
answer. First of all, still staying on this question because it's so intriguing for me, and it's so
Why?
interesting as well, though. Do people who stay awake, who choose to, or you choose for them to stay awake through the procedure, whatever is required, do they freak out during the procedure?
So you have to select the patient, you know.
Right.
So for me, it was like it took me a bit of time to identify the correct patient before I could introduce this surgery in Pakistan, you know. Because obviously you're doing, there've been people practicing here for God knows how many years, 40 plus years, so in their 70s or something. So yeah, whenever you select a patient, a neurosurgeon has come. First surgery needs to go very well, you know.
Of course, of course. I mean, you don't have
So
many
what
options.
I did was like, I selected a patient and I spoke to him. He's a very, as I said, father of a staff.
Of a staff member,
And
right.
he was like, he was actually, I could see that he was
Calm person. Okay.
relaxed. He understood what I told him. And then I told him, this is how I'm going to do it. And this is better for you. And he decided to go ahead with it. And he was such a nice chap. He was like reading surah during the, when I asked him, because the speech area and motor area was close to it.
Okay.
Like that controls the half of the body.
All right.
And obviously, I don't think you can play the video there, but he was the sound there, but he was like literally reading surah through it.
Mashallah, that's so
these are the people that, that's why I came here, you know. So this, our country needs all these things as any other country.
Of course they
And
do.
being a Pakistani, living abroad for 2 decades, I think nothing has changed in me.
All right, so this is where actually I was coming, you know, so you've studied from abroad, of course, you've practiced there as well, and then you decided to come back to Pakistan because for whatever you learned, you felt like there's a need to pay back to the society, of course, again, because there are some areas where we lack in terms of facilities, medical facilities especially. So you're doing that, it's amazing. Can you share one of your hardest surgeries that you feel was, I mean, hard to deal with or was the longest? Any story that comes to your mind when I say this?
Yeah, well, I do skull-base quite a bit as well.
Yeah.
So, in skull-base surgery or vascular surgery, I do brain aneurysms as well. But 90% of them get clipped, I think. But brain aneurysm surgery, I do. That can be challenging at times.
Okay.
It's like you have to literally. I mean, I tell every time I do brain aneurysm, that can't be dealt because now that has evolved as well.
Okay.
90% brain aneurysms can be treated by somebody who does it through the groin.
Oh, all right.
They stick it's like a brain hemorrhage, you know. They stick a wire through the groin and they coil the aneurysms. But those that they can't do, and you have to discuss with them what they can't do.
All right.
And that is something I think currently I'm working on developing here, the service. But if I'm doing a brain aneurysm, every time I do a brain aneurysm, I tell them, listen, 1% of my life is gone.
Oh, why so?
It's very stressful.
It is definitely stressful, right?
So there's a started saying every time I clip an aneurysm, I just go,
Finally, I'm done with it. All right, it's amazing. But you know, it's on a lighter note, though. For a
yeah.
lot of people belonging to my generation, we have sort of grown up watching Grey's Anatomy. I'm not sure. Have you watched it? Do you know about
not
it?
really.
All right, so it's a show about doctors and how whatever goes down in a hospital, you know, their love stories and everything, and patients coming in. But that is depicted on such a lighter note that every person who watched it, they were like, I'm going to be a neurosurgeon, I'm going to be a cardiologist, not realizing how stressful of a job it definitely is. And especially in your field. I mean, when you're dealing with the spine, when you're dealing with the hemorrhage in the brain, you have to do it with such intricacy. I mean, you are dealing with someone's life. It's a matter of a second, right? Of course, you've mentioned that 1% of your life dies because it's all stress out there, but how do you deal with it?
So, yeah, there are the reality is neurosurgery people, I mean, it depends on your training. I mean, the way I was trained is that for me, every patient is important, okay?
Of course, right.
And for me, patients, they've traveled from, God knows, I told you earlier, from Rahinyar Khan, Sahiwal, God knows where, I mean, and every patient is important for me.
Okay.
And that does put stress on you, but I think swimming is a good exercise.
Right.
I've taken up swimming these days.
Right, it's a stress release exercise, right? So it works for you.
Yeah.
All right, that's amazing. So like you mentioned, a lot of people come to you from different areas of Pakistan. So even right now, a lot of people are watching you from more than 40 countries as well, and in different parts of Pakistan, in so many different segments of the society as well. And maybe some of them have, you know, loved ones who are going through something. So can you please share with us the let's say surgeries that you offer or your institution offers or any sort of care that you do offer for everyone out there who can maybe come to you?
So the reality is I offer most of neurosurgical procedures that are offered anywhere in the world.
All
Okay?
right.
And I offer them at a standard that is international standard.
Yeah.
Okay? And things that I do are maybe slightly different, even internationally and here. So, for example, a straightforward thing that I do, it's a very complex thing. It's like a pain in the face, trigeminal neuralgia is called that.
All right.
And that's like something people used to commit suicide because of that pain. It's so severe.
Imagine, oh God.
Yeah, there's a bridge in London, in Highgate. It's called as the suicide bridge because of that reason, because there was no treatment available.
Oh.
But if they are medically unmanaged, I do operation, but I do, for example, instead of doing a cut and all this, that, I am putting a large retractor and pull the brain apart. I do it retractorless and I do it endoscopic. And it's a very deep seat, it's a very delicate, and it's probably one of the most refined neurosurgeries that you can offer to anyone.
Of course.
So I offer these kind of surgeries at a level that sometimes they might not even find it internationally.
Wow, that's amazing. That's absolutely amazing. And you know, it's great to have such people come back to your country and serve the society because again, like a lot of people sometimes cannot afford to go abroad, sometimes cannot even afford to have these treatments inside Pakistan, but you're offering them. Thank you so much for doing that for the society, and thank you so much for being here. It's always lovely to be in conversation with you, Dr. Saab. So ladies and gentlemen, of course, we've mentioned all the available facilities that Dr. Saab has offered in his own institution, that you're working at Shifa International, right? All right. So that is amazing. If you need to, of course, ask him, is there any contact that they can reach out to you at? Shifa International website official. All right, ladies and gentlemen. Right now, we're heading out to a very short break, but when we come back, I told you we're observing an International Day, and it happens to be International Day for older people, elder citizens. This is what we will be talking about, so stay tuned. Good morning.